take the first step on an important journey tonight. This is the first big step for Governor Carney and myself and the other legislators and vested community members who came out this evening to really begin to address the problem that we have in our state with the opioid epidemic, but the bigger picture that we have with issues of a system that doesn't always work fluidly and well together, that's fractured around the issue of mental health. And this evening, we are going to have the opportunity to not get too comfortable or fall asleep where you are in place. We're going to be breaking up into some groups in a few minutes and have a chance to really roll our sleeves up. I stand here tonight, and there's Dr. Rattay, if you would please wave, ma'am. Dr. Carol Rattay, Division Director of Public Health. Her cohort, Elizabeth Romero, could not be here tonight. She's with the Department of Substance Abuse and Mental Health. They've had a big part of this evening and working with us and my staff to coordinate. And I can't thank you enough. As I look out here, I see persons with every sector, individuals who've experienced the loss of a child, which is truly the most devastating. And that's what brings me to the dance. I am a mom first, I am a nurse second, and that policy role is last. But because what matters today is this journey. Too many heartaches, too many lost dreams, too many shattered visions of our future. And we're going to change that. All eyes are on our nation. Last week we were published in the USA Today, and I'm so excited that Delaware, once again, is going to be moving steps forward to really address this issue in breaking down silos and moving us forward in the area of both opioid epidemic, but most importantly, the behavioral health system. And I use that word behavioral health, it's kind of the old term for mental illness and mental health. So, you didn't come to hear me talk tonight. I came here with a group of people who really care and who are really, truly invested in helping our community. And it starts here. And I could go around each chair, and I know my staff would get mad if I did that, and introduce so many of you who I feel have expertise. But I don't want anyone in here not to speak up tonight. We certainly are going to be in groups. We're not going to be televising the whole thing, but you're going to have that opportunity to share from your experience. But we do want you to know this represents every facet of our being. We have folks here from the health field. We have physicians who are psychiatrists, psychologists. We have our law enforcement, our city chief of police, the Officer Tracy. He's hiding in the back with our Secretary of Homeland Security, Secretary Coop, who gets a long commuter award. And I share that because they're invested. No longer can we have that fractured system of law enforcement on one side or our schools fractured on another side. So we're bringing those systems together. Our children, our families, our law enforcement, our public health leaders, and we are most importantly our community and our providers. So tonight, again, Governor Carney is so excited that we're launching this great consortium. And the final acknowledgement two final acknowledgements I want to give, those who are on our Behavioral Health Consortium, if you will wave your hands, please, wave. We want to say thank you to those who are serving with the Behavioral Health Consortium. We want to also highlight, you don't have your crown, but Miss Delaware, if you will stand, her main theme is breaking down that stigma for mental illness and to make sure that all persons are respected and have insurance and have parity and cared. So we're excited that she took the time to be here. We have a couple representatives who are going to give brief comments, but for those of you who've had to work with my office over the past couple of weeks, and will do so, I hope, over the next several years, I want to just point out my staff, if they will all wave where you are. Keith, Laura, Brian, and Tanner very much want to be accessible to you. So with that, welcome to tonight's kickoff. It's going to be informal. In a little bit, we have refreshments outside. But behind me, I have a group of really dedicated, hardworking folks who I believe they may introduce themselves after our reps. And I promise you, the one thing I'm very good at is time. So for those who know they won't have to leave and get home at 8:30, because you want to get rest over the next 2 days before the Eagles parade. I will make sure that you get out of here tonight. With that, I'm going to turn this over to a couple of the reps who come in. We've got Representative Potter, who will, I know, introduce a couple of his colleagues who are here as well. And I know we've got staff from the legislature, Representative Bentz's office, Senator McDowell, and I know Representative Keeley and Representative Short's offices as well. So, Charles, your district, here we are.
Good. Good evening. And welcome to the first state represented district. This is my district, the highest voting district in the state of Delaware. Matter of fact, this P.S. DuPont, this lovely school, is my alma mater. So welcome. I'm happy to be here along with the Lieutenant Governor and to discuss the issues related to mental health and drug addiction. A couple years ago, I did a House Bill 343 that basically talked about crime prevention and drug rehabilitation, because we should not be locking people up. Back then, when I did that, we went to the, down to the, I'm going to say the morgue, but they call it something else. Forensic building, yes. And we were doing a study, and we found out that there were more people were dying over drug overdose than just shootings, because we were looking at the shootings. So this isn't everybody's problem. You know, when we talk about crack cocaine, that's a problem. So we didn't have to wait until opioids came to say, well, this is a main issue. We tried to get the state to open up a lot of detox facilities long ago. They didn't want to do it. Now everybody's on the same page. So we can't just wait till it just affects one group of people to start working. You know, because when Raheem and Shaquilia has a problem, just like John and Mary, it's an everybody problem. So now we got a good look with all these people, all the diversity, to look at helping everybody and not just a few. Thank you.
Thank you, Charles. You don't have to necessarily speak. You probably got two of the more quiet. Well, one's quiet and the other's a little energetic. Representative Mulrooney. And for those who just came, we will make sure you get seating, and we will be breaking up in groups, so no one will have to stand for 2 hours, we promise. But Representative Mulrooney's been on the Behavioral Health Consortium with us, long-term supporter. We appreciate your being here, sir. Thank you. If you have anything to add, you can.
No, I'm just glad to see a big turnout. You know, it's a serious problem. We all know it. It's great to see a big panel up here to, you know, hopefully address some of these issues that Charles talked about, the Lieutenant Governor. We got our work cut out for us, but, you know, I see a lot of good people out there that have been fighting the fight for a long time. We got a long way to go.
Yep.
I'm in it.
You're in it to resolve it.
Yep.
Yep.
Everybody.
And Representative Brady, thank you for coming out. If you want to say hi real quickly.
Good evening. I want to compliment all of you for your participation, but also your interest in this critical issue. I served many years ago with my colleague, Wilmington City Councilman, Representative Potter and Councilman Potter, and many of the delightful faces that I see there this evening I've worked along with in my city government days. And the only thought that I could leave you with tonight is when we were council members, I thought for a long while, lifelong resident of the city of Wilmington, they thought that these types of issues were you know, city issues. And I was very delighted when I got to the General Assembly and met two of my colleagues, who Bethany was, and Lieutenant Governor was a rep at the time. I was delighted to know that indeed the rest of the state. But sadly, we have to be attentive to it in that it's here, but fortunately, we're working together to solve it. So,
Thank you, Drew, and we appreciate that, and his service as a veteran. And the one thing, again, that I'll wrap up, because we want to get, I know, the show going and introduce our facilitators. They are not going to sit here and be talking heads tonight. We're going to be interacting. They're going to help lead discussion, because tonight, we really want to walk out of here with the beginning of a long-term vision and some strategy. And we're going to be answering 3 or 4 very specific, simple questions in breakout groups, because we're going to walk out at the beginning to really address this problem. You know, if we're going to get to the problem, we got to get to the core, and we can't talk at it. We got to walk for the walk. And so this evening, we just want to say thank you to facilitators who are here present. Dr. Sandra Gibney from the Emergency Department is a big supporter on our Behavioral Health Consortium. But as a facilitator, we have Joel Harris, who's with the St. Patrick's Center. We appreciate that. Many of you know Sherry Dorsey Walker, who's been very passionate in our community as a former city councilwoman, and you name it, she's involved with it in the community. And Edwina Bell, who most of you know from her work and her lived experience and her work in the community. And then Dr. Deborah Gilbert-White, who's done a tremendous amount in the housing community and also underserved and homeless. So again, we have persons representing the big picture of social determinants of issues of health. And then certainly Dr. Penny Lewis, who is a nurse practitioner and has worked in different facilities in our state. And then Margaret Guy with the faith-based community, because we all know that spirituality is a big part of this, and you met Charles. And so with that, we're going to turn this to Mary, because again, we're going to make sure we keep this on time. We're going to get everybody chairs. Keep this on time and chairs. And also, we have resources outside. Should any of you have come this evening in hopes of getting information for a loved one, we do not want anyone to leave here this evening without help. Delaware's Help is here. We've got programs. We've got resources. I see SOD and others who've been doing innovative programs in our community. Trust me, if you are here in need, I think there's someone who could help you. So again, do not leave if you came with an intention of getting resources. We want to be there. So Mary, I'm going to turn this over to you. And again, we just want to say thank you. We're going to get you chairs and we're going to break this up. And again, show up if you'd like tomorrow night in Dover, the next night in Delaware City, next week Georgetown, and we're going to be back in Wilmington later in the month at a much larger facility on the street level. And I've already been brainstorming with some of the folks in law enforcement and the community on where that might be.
Excellent, thank you.
Yes.
Thank you so much. And I want to say that my name is Mary Kane. I work with organizations to try to make sure that people understand the value and the power of their own voice. And so that's really why I'm here tonight. I had the great pleasure of working with Lieutenant Governor and many others many years ago on the Cancer Consortium, and I don't know whether any of you folks were involved in that. But enough about me, this is really about you. Before we go any further though, I know that everybody in this room knows everyone else, more or less. Is that true? More or less? Well, what I'd like to do is, if you do not, just say hello to the person next to you. Let's get this out of the way, because you all do love to talk. Okay, that's it. That's it. Come on back. Come on back. I want to thank you for making me feel so welcome, and I'm very aware that I'm a visitor. Where I'm from, we have the same issues, but the approaches that you folks are taking to tackle these issues are so important. And this sense of the community solution. The community is the solution, and each of you is a critical element of that. And I want to make sure that we honor that tonight. There are a couple things I want to mention about how these things usually operate. And I know I'm talking to the choir here because you already know this stuff. And that is, in settings like this, some of the rules or some of the guidance that we try to follow is basically, tonight we're focusing on questions. We're focusing on 2 questions only. And we want to ask you to focus on those questions while we're in this room. We then want to ask you to focus on your knowledge and experience. Don't guess about someone else. Don't try to explain someone else's opinions or feelings or anything. Focus on your own experience. It is critically valuable that you have that. We want to make sure we try to use time well. We'll see how that goes. Of course, we already have a great sense of respect for each other's opinions and values here. We want to make sure that we respect everyone else in the room for making the effort to be here. This is a remarkable turnout, and I'm really gratified because it's all just emerged because of the work that these folks have done. Make sure you make room for other people to talk. This is a big crowd, and we're going to be having like 5 or 6 different pods of people, so it's going to be noisy. We may even ask a group or 2 to go out in the hallway just to give yourself some air and some space to talk. And then just try to listen to what's happening around you as well. So those are basically, you know, the simple rules. The simple rules of communicating with each other. Bethany already told you about restrooms, so she really stole my thunder on that one.
The nurse, sorry.
I want to mention that tonight is the start of a process, and Bethany has already suggested that. I want to mention to you all that you've come tonight, but there are several other ways that if you think of something that you didn't get to say, or something that someone triggers another thought later on, there are a couple of ways for you to do this. One is there are index cards on your chairs. Just write down that idea or thought or concern or whatever it is and hand it to me or any of the Lieutenant Governor's staff. Other ways that you're going to be able to participate, if you like, after the fact, are that we have an email address you can send ideas to, and we also have a little Survey Monkey 2-question survey that you're going to get afterwards. And there is a sheet of paper that you will get that looks like this, that has that information on it. If we run out, we'll get you one, we promise. And it'll also be posted through the Lieutenant Governor's office. Any questions right now about how we're going to try to really work effectively and fully within the next 2 hours?
What are the 2 questions?
I'm going to tell you right now.
And they're going to break out a little bit under that, too,
Yeah.
you know.
Now let us go to the 2 questions. I think that that's a really important thing for us to do right now.
And as she's going to the questions, I know City Councilwoman Hanifa Shabash's staff I saw earlier, Larry Morris for Governor Carney's office. If I'm missing any others, we just appreciate the electeds who take time to be here, right?
Yeah,
So let me give them a
absolutely.
shout out, yes.
So if we're ready, I'm going to tell you the 2 questions. We're going to concentrate on question 1 first, and then question 2. Isn't that a crazy way to do things? But let's try it and see if it works. So we're going to start with question 1. And remember, this is going to be in your group. So your facilitators, these wonderful people here, will have copies of this for you in your group as well, so that you in your group will be able to focus on question 1 to really get us some thinking about this. Not everyone's experience is the same, and question 1 is to really help us articulate that. The first question is, when you think about mental health and addiction, behavioral health that is, and how that affects your health, other people's health, the people that you care about and so on, what is happening in your community? That's the question. What is happening in your community? So I want you to think about that for a minute. The second question, after we take a little break around 7:15 or so, is what is the number 1 thing we can do? And there are a lot of number 1 things, so do not limit yourself to that. What are the critical things that we in Delaware can do to deal with these issues? And there are going to be many, many things that come out of question number 1 that's going to help you think about that question. What are you going to do? And we don't want to start with the what are you going to do question. We need to have kind of a common sense of what's really going on in communities before we can talk about how we're going to address it. Does that make sense? Does that make sense to folks? So let us do that then. And I'm going to ask this wonderful team of facilitators back here.
Question or comment? We'll
Yes.
take a couple of questions or comments. And Mary, we probably didn't make it quite as clear. We used this process very successfully in Delaware. We cut in half our cancer disparity rates, and we've really used this process because it's grassroots. I know you mentioned it. So tonight, if it's like, well, gee, we're just talking, answering 2 questions, we will, hopefully in 6 months, a year, 18 months, 2 years, have very clear, tangible success stories and outcomes and changes. Some might take us 10 years, some might take us 2 years, but we're going to listen to you, and this is not going to be a report. Governor Carney and I do not want a report sitting on a shelf.
That's right.
This is going to move. So we wanted to make that clear. There was a question in the
Yes,
back?
question?
Yes.
Can you just repeat question 1?
Oh, you're going to get them again.
You're
We're
gonna
gonna
get 'em
in
again.
a breakout.
Okay.
But the first one is thinking about mental health and the critical aspects of behavioral health, especially addiction, in our context. What is going on in your community? What do you know? What do you observe? What do you understand about what's happening in your community? Your community, of course, is defined by you. It's what encircles you. So think about that, because we have many, many different communities, all of them communities of Wilmington in the room. So, any other questions before we go forward?
Question, comments from anyone? Yes,
Yes.
Todd.
I would just like to thank your honors and really applaud Lieutenant Governor Hall for the breadth of multidisciplinary team that you have on the consortium. And I really am excited to be a part of this think tank and clearinghouse and look forward to working together.
Fantastic.
Thank you. Thank you very much. And it is multidisciplinary. You have folks here who are retirees, grandparents, mothers, doctors, nurses. We're all one here. You know, my favorite saying as a nurse, we all bleed red. And we all do feel this impact in our community, and it touches us all. We're going to make a difference together, and all eyes are on Delaware, and I am convinced that we are going to be the test pilot in the future where people look at what we've done right, and I'm excited to have your help. Tonight, if you do have to leave early, please let our staff know. Please don't leave here without sharing an address, email, phone number, because we want to be in touch. And again, to the consortium members, thanks for taking your time. Are any other comments, questions before we follow directions and get this moving? Anyone? Nope. All right, Mary.
I'm very excited about how this is going to roll. Yes? Oh, fantastic. How many?
3.
3. Super. We've just been told that this building has classrooms in it. So why don't we use them? Let us begin. We were thinking of groups of about 10. So, and this is in
And
in
spread
and of itself
out if
is a
you
pilot.
can. You know, we don't want 10 police officers, no offense, cops.
Yeah,
so
you
we
gotta-
don't want 10 nurses,
Spread the
10
wealth,
cops,
spread
you
the
know,
wealth.
so try to diversify the groups you go into.
So let's just count up for the fun of it. 1.
Murder. Oh, she can improvise. How are you guys? Do you guys
It says, when you think about mental health and addiction, how behaviors affect health, how people feel about their health, what's happening with them.
Behavioral health, how behaviors affect health and how people feel about their health when you do it. What's happening to your community? That's totally different than the
She shortened it just for easier.
Yeah, but you can't shorten it and get the same